The consistent rise in care costs, and a subsequent decline in the benefits associated with seeking healthcare, have affected Americans' ability to access required care. Women are greatly affected by cost-related issues to accessing care, as well as medical debt, compared to men. Particularly, some sources suggest that more than half of women, at around 52%, report having issues accessing care due to cost, while 45% of women have accrued medical debt. 3 in 5 adult women above 65 years have problems paying their medical bills. Other sources suggest that women are more likely than men to report medical debt problems at 29% compared to 23% of men. Women, especially in their reproductive years, use healthcare services more than men, and as such, they are more susceptible to the negative outcomes associated with flaws in healthcare systems, especially higher out-of-pocket costs. 7 in 10 women are either uninsured or underinsured, have medical debt issues, or experience cost-related barriers to accessing care. Although men and women are insured at almost similar rates, women are more likely to forego, postpone, or avoid needed care than men because of related costs, have issues settling their medical bills, and subsequently accrue medical debt. Problems with settling medical bills force women to make difficult choices between seeking healthcare and affording basic necessities. A third of women and a quarter of men with medical debt issues cannot afford basic necessities, including food, shelter, clothing, and heat for their homes. These trade-offs are more common with underinsured women at 55% and uninsured women at 46% who had to make such decisions. As of 2007, 45% of women and 39% of men were uninsured, with the rate being highest among those with the lowest incomes. 3 of 4 adults earning less than $20,000 annually are either underinsured or have gaps in their insurance coverage, with the number being 1/3 of those earning between $40,000 and $60,000 annually. Women have high rates of public insurance coverage, and even more women get employer-sponsored insurance compared to men. Women who lack employer insurance receive it from a different source, such as a spouse. Firms and employers are constantly sharing the cost of healthcare insurance with their employees, with a lot of these employees having difficulties covering the out-of-pocket or co-sharing costs. As mentioned, men and women report similar rates of insurance coverage, but women have slightly higher out-of-pocket expenses as a percentage of their income compared to men. 35% of working-age women, and 31% of working-age men, spend more than 10% of their income on out-of-pocket expenses. Some studies suggest that the number of women on $20,000 a month and spending more than 10% of their income went from 29% in 2001 to 55% in 2007. 1 in 5 women on more than $60,000 also have high out-of-pocket expenses. Overall, women are more likely than men to skip prescriptions, medical tests, treatment interventions, and follow-up visits due to related costs. Particularly, 52% of women and 39% of men report skipping treatment because of cost-related issues. Approximately 45% of women and 36% of men forego or delay cancer screening or dental appointments because of cost. 4 out of 5 women with medical debt delay necessary health care requirements because of cost when they have unpaid medical bills, with the rate of delaying treatment for those without medical debt being 29%. Delaying or postponing needed care persists across all income levels, but the effects are more common among those with moderate incomes of around $40,000. However, women on moderate incomes are kinda worse compared to men when it comes to postponing care at around 52%. The lack of insurance, while it might be at around the same rates for both men and women, has greater effects on women compared to men. 70% of women, compared to 50% of men, who are insured are still underinsured and report cost-related problems to accessing care. Underinsured women report cost-related problems at rates similar to the uninsured. 1 in 3 insured women report cost-related issues to accessing care. 65% of underinsured women above the age of 50 receive a mammogram, compared to 85% of adequately insured women. Women having more interaction with healthcare systems raises their risk of being burdened with medical debt. 45% of women and 36% of men report difficulties settling at least one medical bill. 3 in 5 women with low to moderate incomes, as well as 46% of women with slightly higher incomes have issues settling medical bills, with the number being 50% and 32% of men respectively. The problem with medical debt has been on the constant rise due to greater cost sharing since employers are shifting burdens to employees, as well as job losses, especially during the pandemic. Overall, 2/3 of underinsured or uninsured women report having medical debt issues, compared to half of uninsured or underinsured men. Underinsured women who have medical debt issues have low to moderate incomes, and are more likely than men to be single with children. Lower incomes and higher need for care, especially in the case of children, places uninsured and underinsured women at risk of high medical expenses.